the original idea for building this program initially was to create better access. A lot of times when these children were referred to physical therapy out in the community, it would take 3 to 6 months for them to be seen, and sometimes a waiting list to get back in once the evaluation was taken. So the idea of building this was to have a program under the same roof that was able to get kids in right away.
If they have a need for physical therapy services, we can get them in pretty much the same days they're here for other treatments, and typically have very little to no wait time to see us, whereas sometimes that's not always the case if they were to seek care outside of here.
Most physical therapists go into this career in an effort to prevent problems from ever starting, but unfortunately in traditional models of care, you are oftentimes providing reactive care to an injury or to problems that have already begun or have existed for quite some time.
Often we try to introduce ourselves early in the process when kids are newly diagnosed, and I've had a few instances where it was the patients and their families weren't aware we were here, but oftentimes it's either a sense of relief or excitement, or definitely a strong interest that we're here, knowing that if these side effects and symptoms start to arise, that we have services right here that they can seek out and have right there for them.
But what we stress is what you do at home. You can see therapy every single day, but if you are not doing a home exercise program, you probably are not going to see the benefits that you want. So our patients that are really successful are the ones that take everything we say and implement them at home as part of their daily routine.
Biggest impact that we can have for these kids, especially their families, is helping with not only working with them on some of these side effects that can happen functionally, but also just the education piece. Especially when they're newly diagnosed, they get hit with so much information. It definitely helps facilitate that knowledge and then help come up with a game plan both in physical therapy and for at home to help manage those symptoms and comorbidities.